The whole time I had to go through chemo, I went to work. I didn't take off. And that was pandemic time. My oncologist is like so mad at me. They're like, really? People are dying of COVID-19. Like, your WBC and your neutrophil is barely like zero point 0.5. You literally has no immune system working. But I said, okay, listen, I'm willing to sign a disability form, whatever, so you can take off work and get paid or whatever. I said, listen, I really think, doctor, that depression will kill me first before cancer.
Welcome to Linguist Access Podcast, where we all get together to learn more about inspiring stories behind every journey that will give you the courage to push past challenges and overcome obstacles, all for God's glory, with your host, Shalini Oritaves.
She sounded like, parang madali lang, parang lahat is smooth lang, but it's not, believe me. And on a serious note, I don't know if you will be comfortable to talk about it. I think sometime last year or 2 years or 3 years ago, you were diagnosed of cancer being, right?
Oh, yeah.
Are you okay to talk about it?
Yeah. So it was 2019. It was 2019. It was actually like it was interesting. So yes, being a nurse, and that's another thing too. Like, I guess one thing, like when you get to this point, like, I'm an NP, so I'm seeing I'm the one telling my doctor what to do. I'm like, no, doctor, that's something wrong with me. You gotta order this, as if I'm a family NP, I'm a second NP. And I got diagnosed. I went to the hospital just by myself because I thought it was just a routine CT scan. And I was in my office work. I was in the ER while waiting for the test. I'm dictating because when I see patients, I have to dictate what I did, what medicines I give the patient for the day, whatever. So I'm working. So after the CT scan, whatever, so I put on my clothes and get my computer, my laptop ready because I'm ready to go home. And then the doctor just came in. It was a young doctor. And then he's like, the one nurse came to me and like hold me, and they're like, it's like, oh, there's no easy way for me to tell you, your CT scan came back, like positive for something. I'm like, what do you mean? Like, what do you mean? It's like, I really don't, yeah, I'm not really quite sure. That's why we consulted it's like, can I go now? It's like, you're not going anywhere. We're going to admit you because we already called an oncologist. I was like, hold up. I'm like, what, the conversation is, I'm like, I'm thinking about, I even have to like my kids, I have to ask like some Filipino, my family there, my aunt, can you pick up the kids, auntie? Because like my primary care provider already called the hospital ahead of time. Like, it's like, hey, my patient is going there. So I've already set up. So I like, auntie, I'm just going to pick up the kids after the test, whatever. So then, yes, I was like, you're not going anywhere. We've already consulted the oncology department. Somebody will see you first. I said, hold up. Where? Like, well, there's like lymph nodes or whatever. And then finally, like, when I go to the hospital or whatever, I don't like, oh, I'm a nurse NP or whatever, or I'm this. So finally I'm like, oh, doctor, I'm actually a nurse practitioner. Like, oh, you're in the medical field. Let me print your CT scan result. And it was actually scary because it was like, possible for metastasis. I'm like, oh my God. I felt like my blood from I was like shivering, and then I was sweaty the whole time, and then the nurses was like holding me like and then I remember it's like, is there anyone you want us to call for you? Are you by yourself? I said yes. And then, is there someone I could call for you? I said no, because I was like, I cannot call my mom, I have a cancer, I can't do that. So I just like, yeah. And then I have to work the next day, so I had to call my boss, and then I was like, hey, I'm at the hospital, like, it's possible this, and that. And, does your family know? No, I don't have plan to tell, of telling them right now. So he sent one of my co-NP to bring me food at the hospital. And then I just stay there. My kids didn't know. They kept calling me the next day. I stayed at the hospital for 5 days. They did a bunch of tests. And they keep calling me like, Mom, where are you? And I'm like, oh, I'm just staying at my friend's house. And then my mom is like, where you at? I said, oh, they need to do some testing. But then the last, the, the biopsy they had to do to confirm what type, what stage I am, or everything, it's, they have to do a, they have to get a specimen like in the middle, in between my heart and my lungs. So the radiology, the interventional radiologist refused to do it, so they had to call like a thoracic surgeon. So like how overwhelming it is. You have oncologists, you have thoracic surgeon, and then the way he explained it's like, okay, what we're gonna do, we're gonna cut you from here, and but obviously we're gonna connect you to vent, and then I said, "Hold, we're gonna hold up." I'm like, I did not sign up for this, I did not sign up for this. So we're gonna do a whole. We're gonna hook you to a vent to breathe for you while we do our thing, and while we're doing it, via camera, it's gonna be sent to a big hospital. So by the time you wake up, I could tell you was wrong. And when he explained to me that that's the only time I told my family, like, hey, listen, if I die, I want to see my family and my children, especially. So I was like, it was just funny actually. So they came, and then my children were like, wow, so this is Tita Francis's house. Well, there's a hospital bed. I've been there for like 4 days already. And yeah, and then it was, and then it was more than likely like I have cancer. It was just the stage and what type of what I had. So it was interesting. I didn't get the result until like, so the, oh, as soon as I had my biopsy, that was like weekend, whatever. I worked the next 2 days, and then I, I chose to work because they told me, hey, on Tuesday, the results gonna come out. I said, I gotta be at work because I want to be like distracted. So I told my boss. So my boss, that co-NP who stayed with me that night, and me, we were like have the speaker with my phone on speaker with my oncologist. And so, like, all right. So what I had is like non-Hodgkin's. So Hodgkin supposedly is like more severe than, so it was funny because when my doctor told me, oh, Ruby, ha, you have Hodgkin's lymphoma. My boss, my doctor boss, and my friend are like, yes, yes. I'm like, why are you guys saying yes? You have the less severe form. It's still cancer. It doesn't change the fact that it's a cancer. Why are
Yeah.
you so happy? It was actually, so I'm so glad that even like I guess they were there. Then again, like, the whole time I had to go through chemo, I went to work. I didn't take off. And that was pandemic time. My oncologist is like so mad at me. They're like, really? People are dying of COVID-19. Like, your WBC and your neutrophil is barely like zero point 0.5. You literally has no immune system working. But I said, okay, listen, I'm willing to sign a disability form, whatever, so you can take off work and get paid or whatever. I said, listen, I really think, doctor, that depression will kill me first before cancer. Like, it's depressing. And you're just gonna stay home. I said, I can't do it. I gotta be out there. So it's like, so I have a antibiotic on hand. So a little, like, if you have a little slight of fever, like, go straight to the ER. And obviously that was 2019. The outbreak of the pandemic was like in February 2020. So my friends were like, I started I was the trendsetter for starting the mask because obviously I have to wear mask. They're like, really? We hate you. Now all of us have to wear it. I was like, it's just, so yeah, I started that. I work. I will have my chemo Thursday. Then I work Monday, Tuesday, Wednesday, Thursday. I got my chemo Thursday. Then, I rest from Friday, Saturday, then back working on Monday. Never fail. Even like I was bald. You saw me, those
Yeah,
head
I
rubs and
saw it.
everything.
Everything. And I would just message her and tell her, I don't know if this is okay, but you know what? You are encouraging me. I mean, I'm not going through the same with what you're going through right now, but you're an inspiration to me. And I even told her, gusto ko na rin magpakalbo because of your face. You look so sexy. At saka meron pa siyang pictorials. Grabe.
Oo.
Grabe. The, ano talaga, the story of her life. I was able to really witness
Yes.
life.
So even like I said, in that stage of life, like, that's one of like setback. You have an option to like be depressed or whatever, or just go out there. And I'm like, I'm gonna kick the cancer's ass by being fashionable and happy and bright. Like what option do you have? Okay, I just chose the other option. And like you said, you message me like, oh my God, you inspire me. And I had to see random people like, hey, a friend of a friend, like, you sent me your link, like, because, I'm going through breast cancer right now, or I just want to like how bright you are. Like, it's actually crazy. And then I have this one person, can you do your head wrapping tutorial on YouTube? Because yeah,
That's
you got,
true.
it was funny. But yeah, you know how in the Philippines, like cancer is a death sentence. Like, come on, it is, like, so going through that really like in my mind. But see, the thing for me is I don't want to. But for one, I'm really very strong willed, like I don't really like my kids like really cried and I'm like, what are you crying about? Like, I'm not gonna, I'm not going anywhere. Like, you just have to like have that not strong facade really, but that's the way I am though. I just like, hey, it's gonna be okay.
Yeah, and you were it's so hard to fake that. I mean, ang hirap. And she's traveling. She was traveling, going places. She would do extreme activities. So sabi ko, oh my goodness, like living the life. Alam mo yun, ikaw na buhay, you're trying to, nagde-depressan ka, and here comes Bing, when you look at her, when you see her Facebook, it's like, why am I even sad? She's trying to live her life to the fullest. Kaya sabi ko, talagang very inspiring talaga being. And so, after 2021, you were cancer-free, right? After that? Was
Yes.
2021?
As of yeah.
Okay,
No, 20
20.
so I started chemo September of 2019. Oh my God, here in America, they just like fast and quick. I was like, can we not start chemo first? Can I go travel first? My college was like, no, we're not. I've already called this place to got your port place, your first schedule. They already had everything in place. I'm like, one trip, please, one trip. They're like, like, how they do it here. But like I said, like so I got diagnosed in 10 days. I started chemo already, like within the 7 to 10. Yes.
Wow.
And, so I started chemo and thankfully, like, so I had to do my doctor first, like, you're going to do 8. Okay. Then after 8, I had to do 12, but I'm not gonna like play down. Like I have to like also like kind of like it's actually funny because like, yeah, you go through chemo and like, sometimes like it's so I didn't really had it bad until I was like maybe seventh chemo. That's really like how bad it was. It was really like the pain is too much. It was depressing. And then the funny thing is even at the cancer chemo where I had,
Mhm.
like I didn't have the nausea and vomiting. So I'm like eating over there and then I have some patients crying, young patients crying over, and I go to them and say, "It's gonna be okay. It's gonna be okay." I'm like right there, and
And
the
she got
mother
her
was like,
tattoo. You had your tattoo. And I said, wow, grabe.
during chemo, my niece. So I started chemo in September. In December, my niece got married in San Francisco. So I had the trip a long time ago. So me and my oncologist fought. She's like, "No, you cannot. You cannot go. You're in the middle." I said, I'm going. This has been planned the whole time." I said, "Ruby, why are you so hard headed? Promise, I'm gonna wear a mask." And she's like, "Okay, just." Take this, and I had to take Levaquin a week before I had to fly, like a prophylaxis.
Yeah.
And then that December, yes. And then in February, my grandma was here because my grandma kept crying in the Philippines. I said, if you cry, I'm the one that has cancer. I'm not even crying. Why are you crying? Just come here. So my grandma had to fly over. So in February, her visa elapsed. So I had to fly to Mexico to get her out and come back. So I had to call another friend of mine, the family NP friend. I said, hey, would you mind send me like a 7-day of Levaquin? So I didn't tell my oncologist I had to fly. I became a doctor to myself. I have no choice. So I'm so like hard headed, but thankfully I get with the grace of God, like I didn't have to have those issues. But yeah, it was pretty interesting journey. And like some people like will tell me I don't downplay my experience. It's really so scary. Like it is really scary. It's funny because like Angel, right? Angel
Yeah,
Angel.
yeah. I think I saw it in
She's
your
in San
post.
Diego.
Yeah.
Yes. So she was like telling me things such as she's actually the one who suggested go do a boudoir photo shoot because after chemo your physical aspect will change just like my aunt. I'm like, okay. So she and then she was like, one thing she told me is just like, hey, have you talked to the lawyer and settled all your like finances or whatever? I said, I'm not doing it. I said, what? Why? I was like, I'm not dying. I refuse to do it. Yeah, she even told me like, "Hey, I'm not saying anything, but just did you settle all this?" I said, "No, and I have no plan to. I ain't dying." So I didn't. And she's just like, "Okay."
I know,
So
it's
I was actually,
amazing that look at you. I'm really proud of you being like, if there's somebody that I want people to really, learn, be inspired, it's her. I mean, yes, promise. One of the
ah,
best people that you get to talk with. You feel, I don't know, but you always uplift the spirit of the people around you. And I think it's contagious. That's why I really love talking. Even if we don't get to talk like this, actually, but people should really know you as a person, as a mother, not just an NP, because I know in that career you're really working
yes.
so well, but as a mother, talagang she's an inspiration to us moms. Mga best friends nilang yung mga anak niya. Talagang parang isa lang silang magbabarkada. You traveled in Japan, you went to, so, di ba, alam ko ang buhay niya. Because really, I really make sure that, I also get to learn from other people. Um, life story and her story is something that I always try my best to copy, lalo na when it comes to, parenting. Kasi talagang amazing. Single mom siya, but look at her, the kids are overachiever. Kaya really, really proud of you, Bing. Now, with your current situation right now, Bing, what is your greatest fear?
Being an NP is kind of like a doctor, MD murag doktor, 'di ba? So my responsibility is like now is greater than when I was working as a staff nurse. So, your fear is like, for example, yung ano lang, first of all, my fear is I'm gonna cause harm more than good, like and not intentionally, of course, with the medicine or whatever. If I'm misdiagnosed, something. So that's my fear. So I know, like for a long time before I have this rosary in my car, so my mirror. So like every time, like I would just like touch that, and then I'd say like, please let these hands like heal and not harm, because that is my fear, that I could harm people and intentionally. So because like my responsibility is like different now. Like, when as a nurse, we still have that critical thinking. When you call for the doctor, you're like, hey doc, like, hey, this patient, blood pressure is low, maybe, normal saline probably, because American doctors love that you have that common sense. So, you suggest what to do, right? But at the end of the day, you're practicing under them. So it's different in me. Like I have to make that decision, the clinical judgment. It's my license. It's me. So say for example, like if I have a patient that I misdiagnosed this major depressive disorder, it turned out this patient has bipolar disorder. I gave this patient antidepressant, and it will actually make this patient manic and do consequential activities, things like that. Or with kids, like, that all antidepressant could increase suicidal thoughts, black box warning, stuff like that. So so that's my fear at my current like stage of my career. So I always have that, like, Lord, let this hand heal and not like harm, although I'm pretty sure like unintentionally. So that's my only fear really. So I have that's why, like, I have to, like, when I told you, like, now remember one thing I wrote, the world is like a never ending schooling and stuff. So, and then, like, for example, like recently, my fear with my job. So I've been working with my boss for like 9 years, like I told you. And then so my boss would go out of the country, out of town, and then so his other psychiatrist friend is like, why are you always vacationing? Who's taking care of the hospital? Oh, I got my reliable NP. Ruby's doing it. Like, she got it. She doesn't even call me anymore for nothing, you know? So my boss's friends saw on Facebook that he's always go here, there places and them. And so the boss is like, oh my God, I need to take a break. So my boss volunteered me. So it's like, Ruby, I want you to get apply for a hospital privilege so you can practice. We both can practice at this hospital because my friend Dr. Siddiqui has to go hunting, has to go for pilgrimage. So I'm working at the other hospital for yes. So and then the crazy thing about that's actually one of my fear because when I work in a psych facility period, like that's like the whole unit. But when I go practice for his friend, the other psychiatrist, I work in a big hospital. I have patients from ICU, med surge, ER. So I mean, I haven't worked in the medical, aspect field. So I'm like, doctor, you're making me go and treat this patient's like on vent on like all this meds is like in like IV form. I was like, what? So I go, yeah. So I do. That's another thing because he always volunteer me to work, and then it's like, oh, you did a great job. He said. So I told him he could take another like 1 week like vacation again next month. I have to drive far to get to that hospital.
So you right now
I mean,
you're doing two jobs right now, like going to one.
that was like for he took vacation for 2 weeks, so maybe like twice or three times a year I do that.
Mm-hmm.
Well, so that way that his best friend could take a break, and I have to stop work going like
Wow.
and then, like you can see like you're like, doctor like can you have like a movie? I can't it my to all Filipinos, trust me, even like foreigner, like doctors, they have so much like regard and respect for Filipino like nurses. They even would ask me, Ruby, I need an NP. Do you have Filipino NPs, friend? I'm gonna hire them. I want the tray. I want you guys be very like hardworking. He wants to hire Filipinos. Like,
Oh, that's very
yes.
good.
So that's why like I'm saying, like don't lose hope for those nurses because oh my god, there's a lot of opportunities.
Now you talk about your job, so many things to do. What can you say about work-life balance? Like how important that is to you?
Remember I told you I'm lucky because I had my job offered to me a year and a half before I even graduated. So when I signed a contract, I had the leverage to demand what I need. So I'm like, I'm going to work at the hospital. I don't like taking calls after 7 p.m. Done. All calls go to you because I don't want my sleep to be disturbed. I got a good sleep. So I pre-planned those restrictions, like I can't do this. I'm only going to be working Monday to Thursday. I will have my Friday. If I feel like going to the office to work, yes. If I want to feel, then I have to like work at least one weekend a month, which, like we take turns because there's like four NPs of us. We take turns once a week. So mine is always the second, week of the month. And then I have that, oh, I play pool. That's my work life balance. I go out with my kids. Yes. And I travel. And then I told my boss, by the way, before I signed the contract, I said, one thing that's very important, I love to travel. So do not tell me when I can or cannot travel. You're gonna work around my schedule, not me around your schedule. So, and like, so my boss like agreed on all those terms. So yeah, this is just let's say this is how my day goes. I go to the hospital like let's say 7:30. I'm out of here. I'm out of there like 2 p.m. at the most. Then I have to dictate them. So yeah, it depends on how really I want to have my day, like early or very flexible timing, I'd say. So, it's really very, helpful. So my life is balanced, especially, in mental health. It's not physically draining, but it's not, I don't see that sometimes mentally draining in a way because obviously you have to work your brain, what's appropriate for this patient, this and that. You have to talk to like doctors, insurances, companies, and I have a lot of like responsibility too, not just prescribing. So It's really important. Even my 14-year-old will tell me, Mom, can I not go to school like tomorrow? Why? I need a mental health day. Excuse you. What does a 14-year-old need a mental health day for?
But but you have to recognize that. I mean, you have to respect that, right?
Because
Yeah.
Mom, remember, mental health day. All of us need a break. I'm like, mm-hmm.
We're all entitled
Okay.
is all related to that. Thank
Yeah.
you so much, Bing. Thank you so much for the time.
Last thing for me, Shang, since we're doing it for those future nurses, like we're doing it this interview for you guys. It's meant to uplift you, encourage you, never stop dreaming, never stop chasing, and like again, life. There's no finish line. We get there at some point, so don't lose hope. Just trust me. Like sometimes the world actually has a lot of like chances and opportunities that you don't even know would exist. So just keep doing you.
Before we go, just one last. What actionable advice? You said, you have to keep going. Like actionable advice that you want them to do for now, especially that, there's retrogression. What do you think? How should they prepare themselves for the real battle once they get here?
They're actually like at advantage compared to our time. We really didn't have the YouTube to teach. You know what I'm talking? We don't have the internet to search this, what state, what, like, and then some, I guess like, even when I knew I was coming to the States back then, and, I didn't have to work, but my husband back then said like, no, you hone your skill, like you still have to work. Because I see some nurse, I mean, I don't like stop them from gearing off the map, because some of them ended up like, some of my nurses friend like ended up realizing they want to be a fireman or police officer or whatnot. But if they really want to do it, at least they can do some stuff, but never, never, never like gets away from the nursing world, I guess. And then you can always, like I said, you can always learn through YouTube. There's a lot of like resources for them available. And like during our time, and then don't believe the retrogression or whatever, the recession or whatever. Trust me. That's what we thought back then too during my time. And then you see all of my friends like a year after they're here. So it can always change. It's not, don't believe the 5 to 10 years, because that's the same thing that happened between my time and all of my classmates, like here in the States, like within a year of the when I came. And to think they said it was retrogression that time. So no, don't don't just say like, be hopeless, like okay, whatever, it's 10 years. No, just keep, don't lose hope in checking with your agency. Make sure, keep up to date your NCLEX. I know they expire. Make sure you renew them. The IELTS have like certain time. Make sure you go to Shaleni again if you have any some
Thank
reviews and
you.
stuff.
Thank
O,
you.
diba? Para ano, para sigurado talaga papasa kayo.
Thank you.
Things like that.
Mhm.
Always get your things ready, your credentials ready, because trust me, it's just pop up. Some is just gonna be, you're gonna open, and at least you have an advantage versus all the other nurses that is not equipped and prepared. Because like, if I'm an agency, I would hire someone that's already have the NCLEX and IELTS done, compared to someone that I'm gonna take them here, have them go to school. So always have that advantage.
Yeah, that make everything available and ready.
Yes.
Now, tell us what is the best way to find or contact you, or just get a dose of your content, because she's doing a lot of live videos, and I'm a follower. Like I said, I'm a follower. I make sure that I always, especially when she does live video. So I don't know if you would be comfortable to share that. I'm okay if not, but yeah,
Yeah.
get a dose of contents, because I know that
Yeah.
I'm inspired by you. Um, I am
So
inspired.
yeah, the it's like, I guess it's like funny. Actually, sometimes, to be honest, Sham, like my kids sometimes are like, "Mommy, you're 42." I'm like, I'm a kid at heart, you know. Sometimes my kids was like, "Really, mommy?" Like, you know, because I'm just so like carefree. Sometimes my children are like, "Mom," like, you know, like seriously, because I'll just like make it fun like all the time, and then but it's funny because my children forget, they have this concept in their mind, you know, like sometimes like let's say for example, like if somebody like, you know, dance like this funny dance,
Uh,
and then they're like, don't forget you're a professional, you're an NP. I'm still a person, you know, baby, I do, but I'm still like a person. I want to have fun. There's that, you know, like this is like, because I have that thought sometimes because they're so used seeing me with my, you know, my NP with the coat and everything. And then when I'm on weekends, I look like I'm a 15-year-old. Hey, what, you know, what's up? I get,
yeah.
sometimes I, yes. And sometimes like on, even like on the street, when they see me, like, they're like, oh my God, you guys siblings. And they're like, you siblings are cute. That's our mom. Like, you know, like, you know what I'm saying? So I'm an open book. Like you have
Yeah.
my Facebook. And then like I said, I'm like, I don't, I'm not the type of person to like, I don't downplay things, because all of us, trust me, all of us has this like challenges in life. Like we have problems, but Facebook does not need to know. You know what I mean? Like it's just so nice to like post something like uplifting, fun, compared to just being like so dramatic. Like what I post, like,
Mm,
and you can see it's all just about like fun, and
yeah.
like most my travel, because that's like one of my passion. That's because like I give like little travel tips, and here, this is the place you need to go, like, you know, new experience. Hey guys, when you go Airbnb or wherever the part of the world, go sleep in a cave. Here am I sleeping in a cave right now, like go have fun, like, you know,
Yeah.
like.
Last time you slept in an RV, and I was just, that's amazing, by the way, Bing. I like it. Like, wow. So you get a dose of those contents. We're gonna post it. We'll put it in the comment section so you'd know how to follow her. Because believe me, it will really make a difference in your life. You know, getting a dose of her content, it will uplift your spirit.
And I
Also,
have like
yes.
like, you know, I'm telling you, yeah, you can share, because I have a new adventure right now. So I just bought like an old boat that I'm gonna turn into I'm gonna renovate it. I'm gonna refurbish. So like, you know, the painting and stuff. So I'm into that. So it's like it's a boat that I have to turn into like a houseboat with all the renovations. So I'm into YouTube with do it yourself. So other than NP, that's another work life balance. I'm passionate about that. So you'll see it probably on my one of these days.
Yeah, I
You
follow her.
know, my journey,
Yeah,
my
follow
journey in
her.
life.
Bing Bing Vidal. She's a psychiatric and mental health nurse practitioner in Texas. Can you imagine that? But when you talk to her, you don't feel that at all. You don't feel intimidated. She always makes you feel welcome. She always makes you feel that you have a friend that you can talk with, and you don't get intimidated at all.
One thing too, I don't feel like I'm better than anyone else. You know, from the janitor from the hospital to, I just treat the same. Like I'm no better than any of y'all just because got my master's degree and have this type of job. No, trust me. I'm just the same me.
Yeah, never change. That's why I'm really amazed by the achievements, of
Thank
course,
you.
she has accomplished in her life. But when I'm more than amazed when she remained to be the same. The same person I heard when we were classmates in one of the subjects back in the days. Can you imagine that? Nothing has
I
changed.
know, right?
Bubbly. Yeah, you're bubbly all the time. And like I said, she's making a difference. Yes, she's making a good living, but she really makes sure that she's making a huge difference in our lives. For me, she's affecting my life in a lot of ways. Like I said, not just a professional NP, but also as a mother. That you can always say your kids can be your best friends. That's what she always emphasized. When she gives her content. Yeah, that's why. To wrap it up, I would say I'm really, really proud of you being with your accomplishment.
Well, I'm proud of you too.
Yeah, I
I
don't
love
know.
what you do. I do like, you know, I love what you do. It's amazing. Actually, it's really, you've been doing a lot of amazing things all these years. And I'm like, oh my God, this is this is cool because, we talk a lot on some things too. And then from that conversation we had, all those anxiety and worries he had from then to now, when I look, I'm like, oh my
I know.
gosh, look at her,
She's so
and then you
random.
get proud with other people's.
She's so random. You can talk to her. I'm sorry, Bing. I just know a lot of NPs who really take of, see themselves as wow in a pedestal, and you cannot like just, talk to them like that. But Bing is a different animal. Bing has different spirit. You always feel that you still have her back, and you can talk to her. She's still a friend. Nothing
Same.
else. Thank you so much, Bing.
Thank you for listening to Linguist Access Podcast. Please give us a review on iTunes. Leave a comment. Like, share, and subscribe. See you on the next episode.